Sam Altman. He recently said India cannot make ChatGPT. You know, it became a big furore in the media where he questioned the ability. So I'm just putting a challenge to you. Can IIT Madras do something, let's say in healthcare, can IIT Madras create a chat GPT for healthcare? Let's call it Dhanvantri. So would you be able to create a Dhanvantri using AI in healthcare? Is it possible, or is it really, I mean, it's just out of curiosity?
Absolutely. So, let me just go a little bit behind also. Before Newton invented his Newtonian principles, we had Annambata talking about gravity. Okay, Adyapatana asamavai karanam gurutvam. This has been defined, and this is basically before Newton found out that apple was falling. So, appreciation or criticism of Indian school of thought has been there for quite some time. But the point is, we had a language which was not globally attractive, right? Sanskrit is a very elitist language. Very few people understand that, right? So, and many of our Indian languages have their own scriptures, own text where science has been explained, and we have very good explanation of health from our Ayush and related granthas, from our Siddha. These are all things that people have been surviving using Ayurveda and Siddha. And there are some people who lived for 100 years without even touching one allopathy medicine. Okay, so these are all happening. Well, now, there are two things. Let this chat GPT, there is something called, when you look at computing, there is something called fancy computing, which will make life for you, and then there is something called, serious computing. As of now, I see chat GPT as a fancy computing. Okay, the maximum it can be a human interface, sort of a human interface, equivalent to a human interface, for answering certain questions and chatting. Okay, now how serious? So, see, always AI has been successful in where the cost of misprediction is less. Correct? So suppose I say today it will rain and it doesn't rain. You are not going to go to Supreme Court and give a judgment. But if I say there is a disease problem, if I use it for health diagnostics, I think you can't. Basically, it will be only an aid. So this chat GPT will also be an aid for everything. It can't basically go and start solving. For example, chat GPT did not pass my physics, JEE physics exam. So it cannot be a tutor.
My question is it possible by IIT, along with researchers, to create a healthcare chat GPT using AI?
Yeah. So do we need a chat GPT, or do we need basically a doctor guidance system? Is the question now. That's what I'm coming in.
Okay.
So I don't want something that will replace a doctor. I really don't want. If India has enough population today to employ doctor, and there are people, when there is a health issue, can pay them and they make a living. So I don't want ChatGPT to whether I can build the systems today which can be of an aid, a first aid. So suppose somebody, hey, I have this symptom, can you give me? So at least it will give you some immediate aid, and then it will say go to the physician. Absolutely. So this type of a system alone will work finally. That you can take it as a writing this interview, you can record it. Okay. One chat GPT coming and doing a treatment for you, prescribing medicine, impossible. It's not going to happen. Okay. And even if it happens, it will lead to so much of litigations, and it will go into man. So this fancy computing, I asked about myself, I asked about a lot of other things. Whatever 3 years before, whatever they have trained is working. Now the next, after 3 years, what is going to happen is, because this fellow himself is going to create more information, how it is going to feed and how it is going to update itself is a bigger question that we need to answer. And all with this, it is worth. This type of all these environments. In 1992, when I did my AA course, I wrote one code in Lisp which will keep abusing you. You start, hello, idiot. So just as a fun of this. It will keep you abusing with some context. We wrote it using a language called Lisp. Okay, so, but then it was a rule-based system because we don't have data. It was a rule-based system. Now, All these things will be sort of very nice, fancy computing things. But when you really want to go to serious business, of course, this will help us as an aid. So we will be developing AI engines, ML engines. If India has the relevance, if AI has relevance and the AI is going to be based on data, India is the first prime runner. We have enough amount of data. We are seeing with so many medical schools and medical hospitals and big corporate hospitals today, which are looking at this type of, which has possessed this data. So we have to take these data and form certain very good engines which can be a very, 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 thought-provoking aid for the doctor. And if I am a doctor with just cardiology and I get a heart patient, looking at this data, this tool can say probably there is also some problem with the liver and there is a gastritis which is, trying to pressurize the heart, something like that. No, this type of a so this type of a cross interdisciplinary platform is what this AI can do. And this is what we will be attempting at IIT Madras. And I am sure this will be a great contribution to the world, right? A constructive contribution to the world. And whether we will do it or not, whether I can do a ChatGPT or not, should we do it or not is another question. I will not invest that time on doing such type of a fancy stuff, nor my faculty will do. What we will be interested today is something like an LLM, a large language model. Because today when I want to remove the digital divide for my country, I don't need a ChatGPT today. I want basic language translation. I talk in English, I want it in 22 official languages of the country. So I will work on such type of large language models rather than doing these type of things. Okay.
I think that's thank you for that elaborate and detailed reply, very elucidating actually, and illuminating. Another question, Professor Kama, is that if you look at global stage, take someone like Bill Gates, he has been able to really drive and steer the public health care and influence it in various ways. Do you envisage any players like that coming up in India, say for example, Adani Group or Apollo Group, any of them, coming up in India in a way similar to that of how Bill Gates was able to influence the global public health care for us at a national level? How would you envisage
Absolutely. With the National Digital Health Mission coming up and personalized health records that is coming up, and also the lessons that we learned from the COVID, I think has changed the mood of healthcare in India. Lot of people who can invest money and at the same time have access to technologies. For example, if you take the Apollo Group or the other large hospital network that is there in the country, including Adani, I think they have a set of hospitals. Anybody who has a set of connected hospitals, I think they are in a very good position because they are the Googles in terms of having the data.
Okay.
And that data they must preserve. They should not give it out. And then basically make it into whatever anonymization. And that is the gold mine for them. And that they come and join with an equal, with a like-minded person who can use this data for good in terms of building up what we just talked in the previous question, like a large AI model, which can become a good aid for the doctor. That is something very important. And today telemedicine is becoming very important, and I need to do a lot of things on scale, right? So I would like some sort of a quick diagnosis that is important. If you give me today, I did what do you call as this master checkup, and it gave me a 50-page report. Now, if I go and give it to a doctor, and my doctor is very good, and he wants to completely look because he wants me to be well and healthy. He looks at all the 50 pages, takes 1.5 hours to do that careful diagnosis. Now, if an AI tool can take this data and tell the doctor, hey, look at this is not correct, this is not correct. And if he can just say, can you just comment about this fellow's blood pressure, then they say, so these parameters are correct. I don't think something is wrong. Then he'll go to that page and see, okay, this is correct. Okay, then he just, okay, fine. Or this is wrong, just go and investigate. This type of a very interesting thing will come out of these large corporates because they have a lot of data. So, large corporates today making a big national impact. And what as a consequence of it, what happens is the time I spend to actually diagnose and prescribe a treatment for a patient as a qualified doctor decreases. The time decreases. So I can now handle multiple patients, more number of patients. The throughput, if you can say, of number of patients that I could do, and also without compromising the quality of my diagnosis ability. I think that is where this will play a very important role. Today, if you look at the footfall, if you look at some of these groups, why these groups are important? Because they have scaled. They are not looking at one hospital. So you have some 100 hospitals within Chennai, you have a group of hospitals. And when they scale, the reason for them to scale is because they are getting more footfall. There is a need. And now, so their aspiration is to go and reach more and more people, correct, as a group. Now, this type of an intervention will increase the footfall, increase the throughput in every hospital, so they can now, with one doctor, if they are treating 10 patients, with this type of an AI intervention, they can now start treating 100 patients. And that is good for the hospital, that is good for win-win for all. Right? As a hospital, I get more. And that will feed, I'll get more data because of that. Okay, so because I'm treating 100 patients. So this will be a very nice constructive cycle that will be created. So a big group like Adani or Apollo now having data that feeds into a good AI type of model that creates a good type of diagnosability. Now the number of patients they do per hour is going to increase. And by that they are going to get more data, and that is going to keep pumping, and this goes on a very good cycle. I think that is the way we can also today, the number of doctors per every 1,000 people today is phenomenally less. Now this throughput increment is also very important. And that is where these groups will certainly start coming up, and that is the next thing, and we will make a better impact.
No, in fact, my next question is a little bit of a rephrasing or an extension or